So in terms of applying their learning to practice, this is the ethos of exactly what we're trying to do. So we've designed the course so that people who are involved in learning on the course and successful graduates of the course are doing exactly that. So they're helping their patients prevent, stopping them developing vascular disease. I say their patients. I mean, I've got some colleagues who've worked in public health, and their strategy is to prevent cardiovascular disease on a wider scale in terms of a region or even a country. So that's just something to bear in mind. But how do they do it? So a few areas, and we cover the breadth of how we prevent cardiovascular disease, and some of the components. Whilst valuable to all of the graduates, some components might be particularly poignant for some colleagues who are on the course. So we think about global considerations about preventing cardiovascular disease. So we do consider public health measures, which is important, I think, for all of us to consider, whether or not you're doing the course or whether or not you're doing your shopping. We help people understand nutrition, and how they can apply that to themselves sometimes, but also their patients, because that's a big area that as clinicians we often forget about. We focus on new medicines maybe sometimes a little bit too much, and sometimes getting the basics right, such as nutrition, smoking cessation, is important. And you might think, well, hang on, how can I spend a week learning about nutritional components? How can I spend a week learning about smoking cessation? Well, it's not just about facts. We're not trying to get people to learn facts and apply that fact learned to practice. It's about techniques as well. So it's about learning some practical considerations about how you deliver. I'm always impressed when graduates develop their own services, and it's always very pleasing to see this. And I've got some colleagues in different parts of the world. I think of one at the moment who's a nurse by background, who's developed a service for lipid management for patients who've had a myocardial infarction. This is one example of how that graduate has applied their learning into practice. So she's now particularly skilled in terms of how she approaches lipid management, some of the more traditional approaches, some of the newer medicines, nutrition. The whole area of cardiovascular prevention is covered. And so it's about taking knowledge and about using that knowledge, but also for us as tutors and for me as the lead is how we help people apply that knowledge in practice. Anyone can read a book, anyone can read a recent paper, but it's about how you apply that knowledge. We challenge the students to not just know information, but how you're going to use that information in practice, because that is the key in terms of how we help patients.